All right, welcome to our final explainer on chronic low back pain. We're diving into step 5, the option you might consider when things like exercise, meds, and injections just haven't been enough. We are talking about spinal cord stimulation, or SCS, a technology that is, and this is no exaggeration, completely changing what we thought was possible. And for decades, this was just the accepted truth. It was conventional wisdom. SCS, people thought, yeah, it works okay for some types of leg pain, but that deep, widespread pain in the lower back itself, no way. It was considered totally beyond its reach. Well, that entire story has been flipped on its head, all thanks to a revolution in the technology. But before we get into all the exciting tech, it's really important that we do a quick reality check. To make sure we're all on the same page, we're going to start by being totally upfront about potential conflicts of interest and, more importantly, the risks involved. So, full disclosure, and this is really important, this is our promise to you that we're going to give you a truly balanced view of this. We're going to talk about the risks, the limitations, and the chance that SCS might not work for everyone. The whole point here is to empower you to have a really smart, informed conversation with your own doctor.
So let's be super clear here. SCS is an invasive procedure. It's surgery. And complications like the little electrode shifting out of place, getting an infection, or hardware problems, they can happen. They might even mean you need another surgery to get things sorted out. And even if everything goes perfectly, it's so important to know that for some people, it just might not bring the relief they were hoping for.
Okay, with that really important reality check on the table, let's get into the why. Why has the story changed so much? How did a treatment that was once basically dismissed for back pain become such a promising option? Well, it all comes down to how the technology evolved, from a simple tingling feeling to something totally invisible and way more sophisticated. See, the original idea behind SCS was based on this, the gate control theory. The thinking was, if we can create a tingling or buzzing sensation, we can basically distract the nervous system. It's like you're masking the pain signals. You know how you bump your elbow and you immediately rub it? It's kind of like that. And this worked okay for nerve pain shooting down the legs, but it just couldn't really cover that big, deep area of the lower back very well. Now, this is where you can really see the massive leap forward. We went from that constant tingling to a therapy you literally can't feel. We went from a system that would zap you differently every time you bent over to one that's totally stable. But here's the biggest deal, the real game changer. Modern SCS doesn't just mask pain signals anymore. It uses these new high-frequency signals to fundamentally change how the spinal cord and brain actually process pain in the first place. It's a whole different approach. And this timeline really shows you how we got here. I mean, this wasn't an overnight thing. For decades, SCS was stuck in that old tingling model, mostly for people with leg pain after a back surgery. The real breakthrough, the moment everything changed, was in the late 2010s. That's when these new sensation-free waveforms came out and just completely rewrote the rules for treating chronic low back pain itself. So the tech is way different, but what does that actually mean for patients in the real world? What does the clinical research say? Is it working? Let's take a look at the data.
This is a huge deal. For years, SCS was pretty much reserved for patients with what they call failed back surgery syndrome. But recently, some really high-quality studies have looked at a totally different group, people with chronic low back pain who have never had spinal surgery. And guess what? The results have been really promising.
So what does success even look like in these studies? Well, the goal, the clinical benchmark, is a pain reduction of 50% or more. And that's not just some random number. It represents a truly meaningful change in someone's life, something that can dramatically improve how they function day to day. In the latest trials, when you compare modern SCS to just standard medical care, a really significant number of patients hit that goal. But again, we have to be real here. Perspective is key. It's crucial to know that the patients in these big trials are handpicked. They have to meet super strict criteria. Plus, most of this research is funded by the companies that actually make the devices. And remember, SCS reduces pain. It doesn't magically eliminate it. This is not a magic bullet, and for a real number of people, it just doesn't provide enough relief. Now, here's one of the most unique and, frankly, coolest parts of this whole process. You get a test drive. Seriously. Before you commit to getting a permanent implant, a temporary electrode is placed, you go home, you live your life for about a week, and you just see how it feels. If you get that 50% or more pain reduction, great. You can move forward feeling confident. If not, no big deal. The trial leads are just taken out. It is such a critical way to know if it's right for you. So, as we start to wrap up not just this explainer, but our entire series on back pain, let's pull the camera back. Let's look at the big picture and see exactly where this incredible technology fits into the complete journey of care we've been building together. So after everything we've talked about, from exercise and injections to this advanced technology called neuromodulation, what does it all mean for your journey? How do you fit this really advanced piece of the puzzle into the whole picture of trying to feel better? Remember this? This is the whole roadmap we've walked through together. It all has to start with that foundation, movement and understanding your body. Then we add in the mind-body connection, support from medications, and maybe interventions like injections. It's only after all those conservative steps have been really explored that step 5, SCS, even comes onto the radar. It's a powerful, advanced option, but it's for when that foundational work just isn't getting you there. We have covered so much ground in this series. But if there is just one single message I hope you take away from all of this, it's this. Your body is so much stronger and more resilient than you probably think. Our goal here was to leave you more informed, more empowered, and hopefully more hopeful. Thank you so much for joining us on this journey, and we truly wish you the very best.